Hi everybody, Dr. Ahles here. In this short video, we're going to dive into the somatic senses of the body, also known as the general senses of the body. A quick reminder about what somatic senses are. These are things like touch sensations, pressure, vibration, temperature, stretching, and pain. When we talk about the somatic senses, we use a lot of different kinds of receptors to detect these sensations. So a quick crash course in what we already talked about in a previous video. Remember that we have two types of receptors that are named based on their locations. These are either exteroreceptors that are detecting sensations from outside the body, or interoreceptors that are detecting sensations inside the body, from places like the muscles, the tendons, or the joints. Every sensation that we're talking about detecting either comes from outside or inside. So again, every single receptor can either be classified as an exteroreceptor or an interoreceptor. We can also classify receptors based on the very specific stimuli that they detect. So remember that mechanoreceptors are my receptors that are detecting touch sensations or tactile sensations. Thermoreceptors are my receptors that are detecting changes in temperature. Proprioceptors, this is maybe a new one for us, are stretch detectors. Proprioceptors are used to help us figure out where our body is in the environment. So this man's ability to detect that he's holding one leg out and holding his two arms out to the side is based on how stretched out each of his muscles are at various parts of his body. And then of course that last kind of receptors that we talked about are the nociceptors, and those are the receptors that detect pain. So what we're going to do in this video is go through one by one with these different types of somatic sense and talk about exactly how your body detects them. So let's start with the tactile sensations. Remember, tactile sensations are things like light touch or heavy touch, pressure, vibration. I want to draw your attention up to the upper corner of this slide. Going forward, when we talk about different kinds of sensations, you will see this box keep popping up. And this is a reminder for you of the specific kinds of receptors that do each sensation. When we're doing tactile sensations, we're detecting things with the skin. We're detecting things that are outside of the body. So we're using exteroreceptors to detect tactile sensations. And when we specifically do tactile sensations, we're using a kind of receptor called a mechanoreceptor. As I'll show you in a moment, mechanoreceptors are pushed open by the stimulus that they're detecting. So, tactile sensations detected by exteroreceptors that are also mechanoreceptors. I have three main kinds of tactile sensations that different structures in my skin help to detect. The first kind of touch sensations that I do with my skin are what are called light touch sensations. Light touch sensations are our gentle touch. So when we're feeling something very softly, light touch sensations are detected by Meissner's corpuscles and hair follicle receptors. Now, I want to mention, as you're studying for this chapter's quiz and for the exam, we do need to know the specific kinds of stimuli that each receptor detects. So, for the Meissner's corpuscle and the hair follicle receptors, one of the things we need to know is that these detect light touch sensations. We also need to know that light touch sensations, detecting those, this is something that is rapidly adapting, meaning you feel something with these receptors, but we don't keep feeling it, that sensation is adapted away. This is different than when we talk about heavy touch sensations. Heavy touch sensations are pressure sensations. Pressure sensations are when you hold a bowling ball and it's heavy and it presses down onto your Pacinian corpuscles or your Merkel discs or your Ruffini corpuscles. These are slowly adapting receptors, and this makes sense because to detect pressure, we need to have an extended sensation that causes a big change in the structure of our skin. So, 3 types of receptors that detect pressure or heavy touch. That's Pacinian corpuscles, Merkel discs, and Ruffini corpuscles. The final kind of tactile sensation that we're going to mention is the vibration sensation. Vibration is detected by Meissner's corpuscles and Pacinian corpuscles. This is another example of a rapidly adapting receptor, meaning you feel something vibrate at the beginning, but we don't keep feeling that vibration sensation for a long time. If you're a word studier, you can make yourself flashcards for each of these types of sensations and what particular structures help us to detect them. If you're a picture studier, I want to draw your attention over here to my list of structures with these little stars next to them. These little stars are color-coded for you. So every time I see a blue star, I'm looking at a structure that does heavy touch detection. Every time I see a red star, I'm looking at something that detects light touch sensations. And green stars, structures that help with vibration. So whichever way helps you to learn it better, make sure we can keep straight which kind of receptor detects each of these kinds of information, and vice versa. What kinds of information do each of these receptors detect? I told you that touch sensations were detected by mechanoreceptors. So I wanted to briefly show you what a mechanoreceptor looks like. So a mechanoreceptor is something that needs to be pushed open. It has a mechanically gated channel. So when we are holding a bowling ball and that pressure is pushing on our skin and pushing on our corpuscle here, that changes the shape of the membrane of that neuron, causing these channels to be pushed open. When they push open, ions can rush inside, and as they rush inside, this activates the receptor. So mechanoreceptors have to be pushed open, and the kinds of sensations that push them open are tactile sensations. Light touch, heavy touch, or vibration. All 3 of those push open these channels to help sensations be detected. The next kind of general sensory information that we're going to talk about is temperature sensations. Temperature sensations we're generally still detecting with the skin, so for the most part we're monitoring the external environment. And remember that detecting temperature sensations is something done by thermoreceptors, done by the special kinds of cells that detect temperature. So let's talk about thermoreceptors and the way that your body determines what temperature it's feeling around it. We use free nerve endings in the skin to help us detect the temperature of our environment. There's a special kind of protein channel on these free nerve endings called transient receptor potential channels, or TRP channels for short. When I have various temperatures around me, from hot to cold, different channels will open up in response to those temperatures. So when we're looking at how we detect temperature, we're paying attention to which channels are open and which ones are closed. That's how your body knows what the external temperature is. Now notice, we mentioned this before, if we're detecting something that is noxiously cold, meaning something that is painfully cold, or noxiously hot, dangerously hot, in addition to registering the temperature, we will also activate mechanoreceptors to detect that as pain. So temperature sensations, when we're within a normal, not painful level of hot or cold, are strictly going to be detected by thermoreceptors. If we get too hot or too cold, though, we'll bring in those nociceptors as well. The interesting thing about the TRP channels on my thermoreceptors is that in addition to being opened by temperature changes, these can also sometimes be opened by particular chemicals. So a good example of this is menthol and the cold channels. If you ever suck on a cough drop or you have something with mint in it, it'll feel cold. This is because it's opening up the TRP channel for cold. Or if we eat something with capsaicin in it, that spice that's in peppers, that opens up the noxious heat channel. So if it opens up the channel in you that literally feels this is way too hot, it hurts. So a great picture here to emphasize for us the different kinds of receptors and the fact that things besides temperature can open them. Over here on the left, I've got a thermoreceptor that detects things that are warm. So when we're in a warm range of heat, not too hot, not too cold, these channels will open up. When they open up, calcium and sodium can come inside and cause a message. The medication camphor, though, can also open up these receptors and lead to what feels like a warming sensation. We mentioned this one before. Menthol, like we see in mints or in cough drops, will open up the same channel as cold temperatures open up on my cold receptor neurons. And on my nociceptor neuron over here, the one that it detects extreme heat, it has a special kind of TRP channel that's opened up both by very hot temperatures and also by that chemical called capsaicin. So with thermoreceptors detecting exactly what temperature you're experiencing, your body will integrate or will add together which of these kinds of neurons has been activated and how much. And sometimes we can trick these things into being activated using particular chemicals like menthol or capsaicin. We should also talk about the way that your body detects pain sensations. Pain sensations can be detected either from the external environment or the internal environment. So both intero and exteroreceptors are involved. And remember that my special name for pain detectors is nociceptors. When we talk about the pain sensation, its ultimate purpose is to protect your body from getting tissue damage. So if we're sitting in a position that's uncomfortable, that registers as pain, and that pain prevents us from continuing to sit in a position that might starve our body from oxygen. So pain sensations are there to keep you safe. There are two factors that go into detecting pain sensations that you need to be familiar with. The first factor is what we call the pain threshold. When we talk about the pain threshold, what we're talking about is the intensity of a stimulus that's needed to activate a nociceptor. Now, the pain threshold will vary throughout your lifetime. In children and the elderly, the pain threshold is lower than it is in adults. But with this pain threshold, keep in mind that this is literally a physical factor. How much do I need to stimulate a receptor to get that receptor to register pain? Pain threshold is different from pain tolerance. When we talk about pain tolerance, this is where we're talking about the sensitivity of a person to pain sensations. So notice in my picture here on the right, I have someone who is imagining or thinking about their pain being lower than it actually is. This person has no control over their pain threshold. What registers in their body as pain is not something they can change. But what they can change using mindfulness or training techniques is their pain tolerance. Your tolerance is what you're willing to take, what you're willing to tolerate. So we all have the same pain thresholds, but we may have different pain tolerances. All of these pain sensations, remember, detected by those special receptors called nociceptors. When we talk about pain, remember that there are two main kinds of pain. There's somatic pain, which comes from the body. This is talking about things like the skin or the skeletal muscles and joints. We also have what's called visceral pain. And remember, visceral means organs. So visceral pain detected by my nociceptors found inside your organs. Somatic pain detected by nociceptors in places like the skin or the muscles or the joints. Interestingly though, we also have what's called referred pain. Referred pain is a kind of visceral pain, meaning it originates from an organ inside your body. But the way that you experience it is like somatic pain. So this pain that's maybe coming from my stomach is felt on my skin. So we have these maps that show us the locations on the body where we would feel something externally that is a reminder for us of what's happening actually internally. So the most famous example of this is when someone's having a heart attack and they have shooting pain along their left arm. The left arm is where my referred pain from the heart is sent along. Or say someone's having some issues with their kidneys. The kidneys are internal, found about in these regions here, but they may feel incredible pain all along their upper leg and their lower back, perhaps across the front of their abdomen as well. If their gallbladder is inflamed, they may feel that over here. So as you're looking at these referred pain charts, we do need to be familiar with, in general, where would I send out my pain from the liver? Where do I send out the pain from the heart or the kidneys? The ones we have labeled here are ones that are important for you to know. Big picture though, referred pain. I feel it on my skin, but it's actually coming from my internal organs. That's referred pain. When we talk about processing pain sensations, there's two ways that we can do this. Way number one is reflexes. And we talked about reflexes previously in class. Remember that reflexes are completely subconscious, or it's an unconscious response. When you start to step on something that's sharp and painful, you don't have to consciously think to pull your foot away. Your foot will move automatically. Or when we touch a hot burner, we don't have to consciously think about pulling our hand away. It will move on its own. We do also, though, process some pain information consciously. If I'm going to process pain information consciously, that information has to go up to the brain. So the place that I consciously process pain information is in the primary somatosensory cortex. Remember, that's the area where we have the sensory homunculus. So I consciously perceive pain there. But if I'm sending that information all the way up to the brain, I am also probably sending it to places like my reticular formation, the reticular activating system, that makes me more alert or aroused. I'm probably sending it to the limbic system, which is where I get an emotional response to my pain. And I'm also probably sending it to the hypothalamus, where I have an autonomic response. An autonomic response is fight or flight, or rest and digest. So all of these are also unconscious responses, but they're triggered at the same time as my conscious awareness is of my pain. One thing I want you to underline, highlight, star, just because it's an important molecule to know about, substance P. Substance P. This is a particular neurotransmitter that neurons use to talk to each other when they're sending pain sensations. Substance P. Think about it, P for pain. So substance P, my special neurotransmitter used in pain responses. So let's tie it all together. Remember that when we talk about somatic sensory information, all of it that is consciously perceived is perceived at the sensory homunculus. Remember that from this homunculus, the larger a part of the body was, the more information we send to that area. So we talked about how we collect a lot of information with our fingers, with our face, not so much information with our trunk or our hips. We're getting more information from the larger body parts, less information from the smaller parts. And keep in mind that when sensory information gets to your brain, it actually crisscrosses and goes to the opposite side of the body. So when I feel something with my left hand, that's actually sent to the homunculus in the right side of my brain. Or when I feel something with my right hand, that's sent to the homunculus on the left side of my brain. So information crisscrosses, goes to the opposite sides, but it's always ending up at that primary somatosensory cortex, or the thing that we called the sensory homunculus. For all of my friends who like to study tables, I want to mention for you that we have some summary tables here for you that classify receptors both based on their structure and on their function. When I talk about structure, what I'm meaning is, do you have a capsule around you or do you not? So things like free nerve endings, hair follicle receptors, no capsule, nothing wrapping around it. Here's the different kinds of functions that each of these receptors can do. Notice we also have encapsulated receptors as well. These were things like the Meissner's corpuscles, the Pacinian corpuscles. Again, structural classification as well as their functional classification. So if these tables are helpful for you to review, awesome, use them. If not, go back and make your own flashcards from your notes to make sure you can identify the function of each of the types of receptors that we talked about in this video.